that it's important that you eat healthy, and I rightly said that how you prepare what you eat also goes a long role, because talking about this ulcer, we see how it occurs in the stomach when the stomach acid has been damaged the lining digestive tract. Now, some of these things they say are anti-inflammatory, pain that relieves, they say aspirin and so on and so forth. Our specialists will be joining us to talk more about this, because we see how some certain food routines have caused this kind of things that God said go into all the earth, multiply, replenish, did not say give us the right to eat anyhow. Pastor has told us time and time again that your mouth is for charting the course of your life. Sometimes I say, this mouth, you live once, you live only once, so you need to enjoy your life. Then in the morning, you've mounted Eba. In the 11 o'clock midday meal, you take Coke and gala.
No,
by
if you
2 p.m.
that way,
you say mofe brokoto. You're just taking, you're eating it. Then by 6 p.m. you've gone to some pastries and some stuff.
you're eating light.
I like when Pastor said that, look, your mouth is not only for you to eat and just keep putting stops in your mouth for you to channel the course of your life. So if you're thinking, if I can't eat all of this, so what's my mouth for? So you need to watch what you eat. Everything in excess is too much. Too much of everything is bad.
No, there's no doubt about it that whatever you eat matters a lot. Just like you're a function of the information you're exposed to, the way you are, especially when you get older. Especially when you get older, because when you're in your 20s, it's a different ball game. When you're 20,
you're more active.
Yes, when you're in your 30s, 40s, and your 50s.
I feel like it's this thing that has caused a lot of 20s to be fat.
This
because they say that. They say
Look at
that.
it, I feel it's this thing.
No, I'm serious. Should I tell you why, Joy? Yeah. Okay. You see a lot of people say that I'm young, I will burn it out, I have a lot of activity, and you're taking in the wrong stuff.
And then you begin to add weight.
Yes, you begin to, not just only weight, because your lungs are not seen. Your
when you take the wrong stuff,
do you know that?
they affect the things inside.
It's about how you look physically. Some people are slim, but they are overweight.
Yeah, they have bigger bones.
Yes, they have bigger. Some people are slim, but they look. You see, if you go to the gym, sometimes see some slim people trying to exercise. Maybe they have hypertension, high blood pressure, and all of that. So they are told to exercise. You see them slim, but they're exercising. So it's not about your size alone. It's about what takes place inside.
Yeah. So I think I would like to put it to those that are trying to lose weight. Most times you have this ulcer problem with people that are trying to shed some weight, and then they find themselves taking things
overdoing things.
You want to take lemon, too much of lemon. These things are acidic, and then too much of you have too much lemon. You're taking, they call them apple cider vinegar. That thing, I've seen someone take that thing raw. You just put it in.
Because
it's supposed to be mixed with water.
And that's why we have Dr. Ede Odo Osage, who is going to be telling us, are you supposed to be taking all of this? Joy just rightly cited, especially this apple cider vinegar, because you want to lose weight, you want to shed all the tummy, and we know that ulcer occurs in the tummy area. Welcome to the show, Dr. Ede. Good morning.
Good morning.
Good morning, sir. How are you doing today?
I'm very fine, thank you.
Yes, good to have you join us. Now, we've been talking here extensively about ulcer. Tell us, educate us, what are the different kinds of ulcer? And which we've seen some people say leg ulcer, stomach ulcer, peptic ulcer. Tell us about ulcer, the different kinds of ulcer, and are all ulcers deadly, or are more dangerous and more deadly than some?
Okay, thank you so much. Ulcer in itself is the break in the continuity of the body structure, either the skin or the mucous membrane. It could be external, it could be internal, as the case may be. All ulcers ain't dangerous, but there are certain ulcers that you should look at as risky because of the location where it is in the body. Coming in right now, looking at the various kind of ulcers. There are ulcers you have on the skin, what you call sores, injuries. It could be based on the size. You have different kind of ulcers, on right on the body, but right in the lumen, that's on the surface of the stomach. That's another kind of ulcer, which the popular kind of ulcer you call the peptic ulcers. And looking at the peptic ulcers, you could have the gastric ulcers, you could have the duodenal ulcers based on the location, right in the lumen, the intestine. So looking at all these, there are times people will say, okay, for the stomach ulcers, you watch what you eat. Because these could be risk factors in itself to predispose you, to erosion or a breach. Either could be either a bleed or a perforation, as the case may be, and this could lead, to an inflated bowel, as well as collections of intestinal content, which we call peritonitis, as the case may be, and that's an emergency. And tackling that, you just have to be on your top notch. Knowing the line of management, for such.
Okay, sir. Doctor, there is what specialists like you people call food intolerance.
Okay. Yeah. Which of the food?
Well, I just want you to educate us because I know that it actually goes with some digestive problems.
Oh, okay. Depends on the kind of food. There are certain food, for someone who is at risk, either by reason of having ulcers, right of the in the stomach. You say be careful taking food that has a lot of acids, like the amino acids, like the beans. When you eat it late, because of the metabolism, the breakdown tend to elaborate more of peptic acid, the pentones and all that, which could be quite risky and result in more excoriations, more erosions of the bowel, discomfort. You're going to have reflux, upset, depends on the time of the day you take this food. Then also we have what we call lactose intolerance. Some people don't cope with milk because of lactic acid, what it contains. That's another kind of food. There are several kind of food. It depends on the risk factors, as pertain, to ulcers in itself.
Does it also have anything to do with the age factor?
You said?
Does it have anything to do with age factor?
Age factor. Yeah, what you're talking about, age factor is related to ulcer, or age factor is related to the kind of food you can eat, what time of the day you can eat this food, the quantity of this food you can cope with, or the comorbidities. There are certain risks, there are certain ailments as well with the elderly, that they can't cope with a certain food, like the diabetics. You don't want to give them a certain food, because of the sugar level, the glucose level, and all that.
Okay, thank you, Dr. Ede. Please, what are the major causes of stomach ulcer? What are the major causes? Because some people said it's because you don't get to eat early, so the acidic reaction in your tummy tend to eat up the flesh in your tummy and all of that. So what are the major causes? I want to break myths right now because there are different side talks about tummy ulcer. So could you just tell us exactly?
About 80% of ulcers linked to the, let me use the terms you can understand, linked to the stomach. About 80% of it is traceable to H. pylori infection. It's a particular anaerobic bacterial infection, as the etiology. Then also about 20%, it's traceable to the abuse of NSAID. NSAID are non-steroidal anti-inflammatory drugs, such as the diclofenac, name it. Some of those drugs used for pain, naproxen. Taking such drugs on empty stomach could result in gastric erosion.
Okay.
Yeah, a breach in the lumen, the integrity of the lumen, or a break in the continuity of the lumen. That's what we call ulcer.
Okay. So, doctor, thank you so much for joining us today. Are there food routines for someone who has been diagnosed with ulcer? Because and then there are some particular fruits. I would like you to just enlighten us on some of these fruits that, because people just believe that fruits, you can take any fruits, just to stay healthy. I want my skin to be fresh. But there are some particular, I know that there are some fruits. For example, I like to take lemon, not because it's you use it to lose weight, but I just feel like there's a particular amount that I should take in just to have a balance of, my food intake. So what are some of these things that someone that has been diagnosed with ulcer can stay away from? Yeah.
Okay, thank you so much. Not forgetting the etiology, the risk factor, and also what complicates ulcer. There is increased secretion of gastric acid, on an already ulcerated surface on the stomach. And the effect of consuming food that are highly acidic in itself, like the lemon you talked about, on an empty stomach, could further exacerbate or result in more deepening ulceration, the surface, the depth, and that will result to either perforation, as the case may be.
Okay.
Then you want to take food that are basic instead of food that are acidic.
Okay.
That's the reason for certain drugs which the ulcer patients will take. We have drugs that coat the surface, mucosa protective drugs, like the PPI, proton pump inhibitors, the omeprazoles and all that, active protective drug like the Gestid, and all that protect the surface of the lumen, the surface of the stomach and in itself. Okay. So you don't want to take those food that will increase high acid secretion, and also will result in more ulcerations, extensive ulcerations, and even further progress to perforations right on the stomach surface.
So, doctor, I want to find out, there's been this saying, a popular saying, that those people who do not eat early, there are some people who don't like eating at all, are prone to ulcer. How true is that? You wake up in the morning, the first time you have a meal is maybe like 4 p.m. because you're so busy, you don't have time to eat. Are such people prone to having ulcer, or are they the #1 candidates of ulcer?
Yes, I talked about 80% traceable to a particular bacteria we call H. pylori infection, Helicobacter pylori. But however, not eating on time, if there is an underlying factor in itself, and increased acid secretion in itself could further predispose such a person to ulcer. That's a strong risk factor which should be avoided.
Okay.
So are you saying
so
it's
it's
a
better
yes?
You eat your food on time.
Okay, so it's a yes to eat on time.
Yes, eat your food on time.
How early?
How early?
She won't eat.
Your breakfast. Your breakfast is very important.
How early is breakfast? Because some people have definitions of breakfast.
And how big should the breakfast be?
Like a king, you eat your breakfast.
How early?
How large should the
You
breakfast
should do your
be?
breakfast as early as before 10. You should
Before
do
10.
your breakfast.
What's the latest time to have breakfast?
Before 10.
I said the ideal thing, you should do your breakfast before 10 a.m.
Okay.
So
Okay, doctor, just to add to, just to enlighten our viewers, there's this notion that people that have ulcer are supposed to stay away from taking things like pepper. And I kept thinking, if you said ulcer is caused by maybe
spicy
injury.
food, not just pepper, spicy foods.
Spicy food. Okay,
so
injury.
Yes.
It's caused by injury in your stomach wall area. But if
Yes,
you have an injury outside your skin, for instance, probably in your, on your leg, you use things like spirit, and it's peppery. So I'm wondering, why would
How
you
does
just
it
take
work
pepper
inside,
to
but it
heal,
works on the outside?
to heal this thing?
Why you use the spirit? Yeah, you can use the spirit outside. That's an external ulcer.
Okay.
But the one within the body itself, there are certain enzymes elaborated by the stomach. We have gastric acid.
Okay.
Gastric acid itself, so corrosive. Then you now have a breach on the wall of the stomach. That will hit deep into the lumen, through the layers of the stomach.
Okay.
And it could be very painful. And it can even affect the blood vessels within the lumen of the stomach, and that could bleed. That's bleeding peptic ulcer. That could go beyond the entire lumen or the entire layers of the surface and could perforate.
All right.
Okay. So imagine when it perforates, everything within the bowel content could leak through into the peritoneum, into the space outside your intestine. And that's the complication in itself, which we call peritonitis.
Okay. Now that you've said that, if ulcer is detected early, can it be detected early? And when detected, how can someone who already was diagnosed of ulcer, be said to ulcer is totally gone? What are the things that you need to do to take yourself out of that state where your stomach walls are breached?
And what kind of treatment?
Can it be cured?
Ulcer could be detected very early, clinically.
Okay.
When you come to the hospital, we take an history, an epigastric pain, they could be exacerbated even with food or without food over a period of time, distinguishing peptic ulcer from duodenal ulcer. Or don't forget there are other kind of ulcers which are traceable to hormonal disorder like Zolling-Gaelitin syndrome. That's a very high fallacy stuff. But however, we shouldn't forget the fact that there are certain tests, key tests you could do. We could do a serology for the major causative factor, which is H. pylori infection, doing a test for that with a urine breath test or a serology sample. In cases whereby there are complications, we could pass a scope through endoscopy, upper GI endoscopy, with a camera. You take it down to see what kind of ulcer in itself. Okay. Because some ulcer could undergo some malignant transformation, some changes, or there could be subtle representation, what we should call differential, that look like ulcer in the stomach, whereas it could be a gastric cancer. Okay. So you want to differentiate that from the peptic ulcer. So you could pass a scope. When the ulcer is becoming relapsing, not continuous weight loss or continuous vomiting, other findings. They could, you can have someone who could have an ulcer and would have a melanoma stool, a dark tarry stool because he's bleeding, or could tend to vomit blood, which we call hematemesis. Okay. Depends on the stage of the ulcer and depends on the complication associated with the ulcer.
Okay. So can an under 10...
Can this affect pregnancy?
Pregnancy?
Yes.
No, ulcer doesn't have anything to do with pregnancy. It's not there with pregnancy, but however, pregnancy in itself, could be a factor in itself that could exacerbate ulcer. Depends on how managed it is.
For me, finally, how early can it appear? Can it appear in like an under 10 person?
You said? Can I get a question again?
Okay. How early can it appear? Like someone, like a baby under 5, under 10?
Very, very, very uncommon in a baby. Okay. Because their intestine, the lumen structure is at a rudimentary stage, not well developed, whereby the gastric acid, which is an underlying factor, and the H. pylori infection in itself is not elaborated. You don't have it, in itself well developed to be an underlying etiology that will be of concern to us. So most times it's more common. They present in the middle age.
In the middle age.
Okay.
Yes, and also in the elderly, where you have NSAID abused because of comorbid factor like osteoarthritis. They want to take a lot of drugs every now and then for pains. That could cause a breach on the surface of the lumen, on the intestine surface. Yeah.
Thank you.
Okay, doctor. Just a last question from me. I know I've seen someone with ulcer, and there's a notion that once you're feeling a particular way in your tummy, if you take milk, it just subsides. Does it work for everybody?
No, it doesn't work for everybody.
Okay.
Don't forget, the milk in itself needs to be metabolized, it's broken down. Okay. After metabolizing it, that can even worsen the ulcer. Wow. Acid in itself from the breakdown of the milk.
Okay.
So you take it chilled, you could feel some mind relief, but don't forget, the body is going to break down that milk into micronutrients.
Okay, so doctor, what's your
finally,
advice?
That's it. So like she said, when you feel a pain in your tummy, you talked about diagnosing this pain. When you're at home, how do you know that, okay, I'm having the symptoms? What are the symptoms? So that just in case,
And your solution advice to those who might be nursing ulcer?
Being at home, you could notice that the gastric pain right just below your sternum. Sometimes the pain could radiate to the back.
Okay.
It could be worse with hunger pangs. When you're not eating, you could feel that pain much more. That's common with the gastric ulcer.
Okay.
Then also for the duodenal ulcer, you tend to need food, to subside the pain. And such people, most times, it wakes them up at night because moving the food from the stomach to the duodenum in itself.
All right.
Then in other cases, there will be vomiting. And then with complications, you could have, but that could be a very bad state. You could have dark tarry stool, blood in the stool, and also there could be hematemesis, vomiting, with irritation of the bowel with the food you eat. Then also the consumption of spicy foods, could irritate the ulcer surface on the bowel, especially the stomach.
Wow.
And the
Spicy food.
Okay, so now she did ask a question that you've not answered yet. We know our delicacy is made up of spicy food, it's pepper. 1, 2, 3 things that we can have to eat. What are the things we can do? Now you've detected it early. What can I eat to get myself out of that zone?
Good, thank you so much. Detecting it, there ought to be a lifestyle modification. Okay. Dietary aspect of it, depends on the kind of food you should eat. Try to eat your food on time.
Okay.
Little adequate of the food spread over the day instead of skipping your meal. Then also consumption of food that tends to be very acidic. Like you're taking a lemon, you're talking about a grape on an empty stomach when you've not eaten. Don't forget you have to protect the mucous membrane, the surface of the stomach. So it's better to take food that will coat the surface. There are more basic food and fruits than the ones that are acidic in itself, based on the breakdown.
Thank you so much, Doctor. It was really informative having you join us on the show today.
Thank you so much.
Thank you so much.
Thank you, sir.
Yeah. So we've learned, the thing about information, like you rightly said, determines the kind of life that you live. And you don't have to get to some particular, experience some particular things before you know what to do.
You don't have to wait till that time.
So that's why this education is important.